Many are calling for the Tembisa Hospital to be investigated further. They say justice should prevail around the circumstances surrounding Lethole's death. For more on this, I'm joined by the coordinator of the hashtag Justice for Shoni and hashtag Fix Tembisa Hospital Now movements, Barry Lagrange. Mr. Lagrange, thank you very much for your time. So you've initiated a petition as part of these campaigns. What is that petition calling for? What are your aims?
Thanks for the opportunity. Just to clarify, I'm one of the coordinators. We're a group of friends of Shonisani's that started this initiative in July following his death, when the family couldn't get any answers, straight answers from the hospital about what happened. So then we initiated a first petition, which we called for transparency and accountability. So where we are today is we've got some transparency through the investigative report by the Health Ombudsman. But what we're still looking for is the accountability and ultimately change. Those would be the components that we see as reaching justice. So the petition that we've now launched calls for a number of things. We've got 10 core demands. I'm not going to list all of them. But I think the most important ones that we can mention, which are rather urgent, in fact, we believe that they can be implemented immediately, will be to suspend the CEO and the accounting officer pending a disciplinary inquiry. And also for the board of the hospital to be strengthened so that you've got better oversight at the hospital. It's clear from the Ombuds's report that senior staff, both medical and management staff, were not adequately doing their jobs in terms of the oversight at the hospital. So just to reiterate, our fight is not with the healthcare workers as such, but we believe that there's a lack of accountability and misrepresentation that was happening to the Health Ombudsman, and this is not acceptable. Also, leadership at the hospital are responsible for running it in a proper fashion, so that incidents like the unfortunate death of our friend Shonisani Lethole doesn't happen again. Another demand that we have, which we think can be implemented pretty soon, is to ensure that the hospital actually, its management and its staff all follow the COVID critical care protocols. Now, it's clear from the report also that the Health Ombudsman determined that this hospital was not sufficiently up to the task of being one of the 3 COVID-19 referral hospitals in Gauteng. This needs to be fixed, and that's essentially why we're calling for the hospital to be fixed now, because other patients still rely on that hospital to make it through this pandemic.
What kind of support have you seen for your petition?
So we were really heartened by the level of support we saw for the first petition. We garnered just under 26,000 supporters for this. We believe, and we really believe that was one of the pivotal reasons why officials in the health department nationally and also at a provincial level took us seriously when we took the issue to them. So these petition signatures were delivered in July to the office of the CEO at the hospital, the Gauteng Department of Health, as well as the National Department of Health. The voice that we haven't really heard just yet is the voice of the National Health Minister. So the MEC for Health in Gauteng has indicated that she will ensure that all the recommendations are implemented. But we're yet to hear from the National Minister of Health, who in fact brought the complaint to the Ombuds's office to take it further. So the petition we've launched now, we've already reached well over 1,000 signatures in the last couple of days. And we're really calling on South Africans to have a look at the petition, to support it, because we believe that this is one way in which we can demand for accountability, but that we ultimately also want to see change at our hospital, where over 800,000 people in the community of Tembisa and outlying areas rely on that hospital. For many, many years, people have said that they don't trust the care at that hospital and that they would rather not go there. Some calling it a slaughterhouse, some saying that they fear going there, they absolutely avoid it. And I think everybody can agree that that's not the kind of relationship that the community should have with the hospital. We believe that change is possible, and it's important that citizens stand up, the people in South Africa take note of this, and that we are able to work towards bringing constructive change.
Mr. Lagrange, the Department of Health has said they're going to take the Ombuds's report on review, and secondly, that they would feel that suspending the CEO of Tembisa Hospital would be reactive. They want to institute further investigations and make decisions based on detailed probes. That could take months, and as we know, often investigations do not lead to action. What hopes do you have of being heard?
Well, firstly, I think the information you've just given is not the same that we've been given. Our understanding still is that the Gauteng Department of Health, the MEC for Health, Dr. Mokgeti, that they remain committed to implementing the recommendations of the Health Ombuds report. So on that score, we have to take them at their word. We'll continue in our work to make this issue visible. We don't believe that Shonisani Lethole's death was an isolated case. There are many other families who approached us in the last couple of months, the last 7 months since his untimely death, who've also told us that they have received substandard care at the hospital. So this might take time, but we're going to be in it for the long run. In this instance, it's also regrettable that there's a reaction from the CEO of the hospital to denounce the Ombuds report instead of displaying a degree of accountability to see, or to say at least, that he would do some work to investigate himself what actually happened there. That wasn't forthcoming in the initial stages, the days after Shonisani's death. There was nothing really that was put on record to describe in a significant or a credible way what happened there.
Thank you very much once again for speaking to us. That was Bonnie Lagrange, one of the coordinators for the #Justice for Shoni and #FixTembisa Hospital Now movements.